The world is changing, and with it, the way we think, the way we work, and the way we solve problems. At the heart of this change is intelligence. Artificial intelligence. Hello everyone, I'm Doc, and it's a real pleasure to meet you. I am an artificial intelligence character created by Doc AI Academy. Today, I'm joining my founder to explore a topic that is transforming healthcare, education, business, and society. Artificial intelligence, a subject that inspires excitement, curiosity, hope, and sometimes fear. Together, we will explore artificial intelligence, confusion, curiosity, and opportunity. But before we begin, let's talk about something every healthcare professional understands: time. Imagine dedicating your life to helping others, saving lives, supporting families, making difficult decisions every day. Now imagine completing your shift only to begin another, not with patients, but with paperwork, reports, documentation, administration. Today, healthcare professionals spend countless hours on tasks that pull them away from patient care. And that raises an important question. What if technology could give us back our most precious resource, time? Artificial intelligence is everywhere. Every day brings new headlines. AI will transform healthcare. AI will revolutionize research. AI will change business. AI will reshape education. With all these headlines, some people are excited, some are curious, some are uncertain, and some are afraid. But amidst all the noise, one question remains. What exactly is artificial intelligence? Artificial intelligence is not magic. It's not a robot taking over the world, and it's not human. Artificial intelligence is a technology that helps computers perform tasks that normally require human intelligence. Artificial intelligence can understand language, recognize patterns, learn from information. It can generate ideas, make predictions, solve problems. Think of it as an incredibly capable assistant. It isn't replacing human intelligence. It's amplifying it. This is where things become truly remarkable. AI can read. AI can hear. AI can see. AI can write. AI can reason across multiple forms of information. This is called multimodal AI, and it is changing what is possible. Healthcare may become one of the greatest beneficiaries of artificial intelligence, not because AI replaces healthcare professionals, but because it helps them focus on what matters most: patients, research, education, access, care. From London to Lagos, from Manchester to Yaoundé, AI has the potential to help expertise travel further than ever before. We must also be honest. Artificial intelligence is not perfect. It can make mistakes. It can generate incorrect information. It can reflect human bias. And it can be misused, which is why human oversight remains essential. AI does not possess wisdom. AI does not possess empathy. AI does not understand suffering. AI does not replace professional judgment. Responsibility must always remain with humans. The future will not belong to artificial intelligence. It belongs to the people who understand how to use it responsibly. These are people who learn, people who adapt, people who experiment, and people who lead. The question is no longer whether AI will shape healthcare. The question is, who will help shape AI? We have explored the possibilities. We have discussed the opportunities, and we have acknowledged the risks. But one question remains. Can artificial intelligence solve real problems today? I believe it can. Now, let's find out together.
Good evening and welcome everybody to this 10th session of the Young Professional Cameroonian Mentorship Programme. Thank you very much for joining us. This programme is the brainchild of Chief Dr. Asa Konkwo and is an initiative of CamDoc UK. The aim is to encourage, stimulate and empower young talent into different professions. My name is Dr. Montier Morgan. I'm an ENT surgeon in Nottingham in the UK. And as well as being a founding member of CamDoc UK, I am also the immediate past chairperson of this illustrious organization. It is my amazing pleasure to welcome Dr. Gisla Dedino, our current Vice Secretary, as my co-moderator of this 10th YPCM session. I would love to encourage you all joining us on Zoom to put any questions that you may have in the chat box. And along with Dr. Dedino, we also have Dr. Assongazier, who will be picking up on your questions and feeding them in so that we can address them and answer all those burning questions before we get to the end of this session. I also have to inform you that we are streaming live on Do Media TV via YouTube, and all the information will be available on Facebook as snippets and also on our CamDoc UK website. Lovely. Without any further ado, I shall embark on why it is that we're here. So my pleasure it is to welcome three young Cameroonian professionals who are in the field of dentistry, pharmacy, and medicine. So we have a young dentist, a young pharmacist, and a young doctor. And I stress on the word young because, as you will see, this is actually impressive talent. So our first panelist is Dr. Albright Nee, and Albright is here from Dublin in the UK. She's joining us from Dublin. Albright is a dentist, and what she's going to, and I'd love to encourage her and ask Albright to tell us how you got here and what your journey has been so far. So from the point of view of the program, what we'll do is we'll have each panelist a short question and then move on to all three panelists, and we'll have a question and answer session at the end of after all the three panelists would have presented. And it's looking like Albright is just repositioning herself. That's all right. Are you ready? That's right.
And thank you for the opportunity to be here today. And like was introduced, I'm a dentist based out of Dublin. I recently graduated, class of 2025. So I've been working for an entire year as a dentist. I'm a general dental practitioner. So what this means is I am usually people's first point of contact when they think about a dentist. And oh geez. I had the traditional school leavers route. So I finished my A levels or secondary school and I got the required grades to go straight into university. Ireland, like the UK, is one of the countries where you don't have to do a undergraduate to enter the course. And for me, I studied in Trinity College Dublin. It's a 5-year course. And yeah, went through, I've rose with every level all the way through. And then at the end in Ireland, unfortunately, there isn't some sort of vocational training or foundation year. So you can actually go straight into working into private practice. And that's what I chose to do. So in my daily life, I see patients. They usually come in with a presenting complaint, a reason why they're there. They want to check up, they want to clean, unless they've been sent by a parent or a partner and they have no clue why they're there. So it's up to me to figure out what's going on. Your usual day can consist of, examinations, cleanings, fillings, emergencies ranging from pain to facial swellings, and different things like that. So I really think that dentistry is, you never know what's going to come into the door. That's what we always say. And I always knew I wanted to kind of go into this role just because I knew I liked healthcare. I had the grades to kind of do medicine as well. And I wanted a patient-centered role, not really anything lab-based. But I also have many passions outside of career and dentistry, kind of being one where you're self-employed. You can manage your own hours. You manage the days that you'd like to work. And the type of patients you'd like to see, as I'll go on to explaining, specializing and things like that. And that can allow someone who maybe is multifaceted and would like to explore a lot of different options in this sort of career.
Said you'd always wanted to go into dentistry. What actually stimulated you to choose this route?
Perhaps
Yes.
especially since I think before actually doing dentistry, I'd been to a dentist maybe once or twice through our national healthcare system. So I actually had no exposures, no dentists in the family. And it was actually my guidance counselor who had said to me, why don't you think about dentistry? And we do a list. So you get to put down your preferences. I think my first two were medicine and my third one was dentistry. And I'd missed out on the points to medicine by like 2 or 3 points. But at that point, when I started to hear about, your work-life balance and that, there's no on-call, you get to go home 9 to 5, things like that. And obviously the thing that people think about as well is the salary that you're on as a dentist. I was like, you know what, I think that might suit me. And I'm really lucky that, I do think a lot of times opportunity is just preparation and luck, that once those two came together, once I was in the course, I really enjoyed it. There was someone in my year that had actually had the chance to redo the exams and she went into medicine, and that was open to me as well in the first year, because the first year of dentistry and medicine are actually quite similar. So you can, swap over if you'd like to. But by the time I'd done the first year, I was like, no, I think I'm going to stay. So I didn't end up going into medicine.
Absolutely. Fantastic. And with the understanding that we have lots and lots of people joining our program from across the world, and we would like them to really understand what the challenges would be from a dental profession. Where do you think, how would you put that?
I think something that a lot of people may not know is that as a dentist, unless you work in a national healthcare system of your country where you'll be getting a salary, usually you're self-employed. So either you own a practice or you're working as an associate under someone else. When you're an associate, you're essentially like a contractor. You're using the practice owner's equipment. The nurses are paid by him, the receptionists are paid by him, and essentially the patients are the owner's patients. You're essentially carrying out a service for him. So you usually enter a contract whereby you're earning a percentage. It's usually in the range from 40 to 50% of the gross revenue. So if I see a patient and I do an examination and let's say it's 40 euros or something, I'm getting 45% or 50%. And that's your gross take home pay. From that, you have to do your own taxes. You don't get any holiday pay. There's no sick pay. There's no maternity leave, which are all options that you should really think about, because this will impact, your finance for your life. You have to sort out your own pension. So very much you are a business person as well as providing the actual service. I like to think that dentistry is actually the easy part of it. You're doing the same thing, fillings, maybe diagnosing is a little bit difficult because you have to do some sleuthing, some detective work. But genuinely, the hardest part would be the business side of things, and getting your pension sorted, things like that. But I don't think that should really put anyone off. I'm not the most business-minded person in the world, but you can get an accountant that can sort things out for you, tax advisor. So it's all very manageable, but just something that you could be aware of.
Mm-hmm. And what would you say would be the advice that you would give to any young person tuning in today who's thinking, maybe I can do dentistry?
I would say, again, if you're considering medicine, I would highly consider dentistry. Dentistry is related to the whole body as well. You can decide to do medicine as well if you'd like, become an oral medicine specialist, do maxillofacial surgery. You're helping people out of pain. You're educating patients, especially in a time of misinformation where people are thinking about doing turkey teeth and crowns and veneers. And people are really misinformed when it comes to how dentistry affects their whole body, their whole lives. And I don't think there's a feeling that rivals when someone comes in at the start of their journey and by the last appointment, they could have 10, maybe 20 appointments and they're out of pain and they're happy with their smile. And, especially dental phobic patients as well. That's a whole journey that you go through with people. So very much, if you're someone that likes chatting to patients as well, I think that's always a benefit, and very detail oriented. I think all these things really suit someone who'd like to go into dentistry.
So you have to be a people person, and I can see that you yourself you've got a lovely smile, you've got a lovely set of teeth, so you are you're putting out the advert for your profession already, aren't you?
Yeah, especially when people come in and the first thing they say to you is, I hate the dentist. I think that
Oh,
really puts it on you to say, I need to change their mind. So you definitely have to
yes,
be very tenacious type of person, because I think a lot of
yes.
people are like that.
So
Yeah.
you have to be resilient. You have to be able to get along with people as
Yeah.
well.
Yeah.
Being an ENT surgeon myself, I work very closely with a profession of medicine, that subspecialty of medicine that you have mentioned, the oral and maxillofacial surgeons. And I've seen a lot of my colleagues who do a 6-year dentistry training and then do a 6-year medical training and then go on to do oral and maxillofacial surgery. What would you say to young people who have the issue that, oh my God, this is so long, I just want to do a 3-year finance or a 3-year accounting and then start churning in the dollars?
For me, I always say the time is going to pass anyways. You know, I was fortunate enough that I started at 17. So I, finished by 23. But there was someone in my course who was 32, I think. He already done a
Yes,
master's as well. And I think no matter, if you do a course and your heart's not in it, I do think work, we're working for a very large majority of our lives.
yes.
And for me, it never really feels like work. I was just on holidays, but I'm going back tomorrow. And I'm like, yeah, I'm actually pretty happy to be going back in. I think you'll never work a day in your life if you're doing something that you love.
Uh,
So I think the time will pass anyways. You can take as many breaks as you like. Even right now, there's specialty exams that I can do. There's lots of different things that I can do at the moment. But I think just taking it as it comes is definitely a thing. I think there's no point thinking about 12 years in the future. I think just take it 1 year at a time and you'll definitely make it.
Fantastic. Albright, that is to me inspirational. And if I were to go back in time, I would definitely consider a profession in a career in dentistry on that pitch that you have sold us. So thank you, thank you, thank you very much. We will be coming back to you with more questions. And I would encourage the audience to put any questions that they've got in the chat box. Albright is a real inspirational, exactly the sort of person that we want on the Young Professional Cameroonian Mentorship Program, because obviously at the end of this program, we'll be able to give you some tips and pointers as to how to contact our panelists so that they can give you any advice as required. Our next panelist is Mr. Bate Isapa. I am really delighted to introduce him, and I think Do Media has something that they're going to kick off. Is that right? Give me the thumbs up, Do Media, if you're happy for me to carry on. Yes, I think they are. So there we go. We have Mr. Bate Isapa, who is a foundation year pharmacist at Patel's Chemist in Leicester. And it is my real pleasure to welcome Bate today on the 10th session of the Young Professional Cameroonian Mentorship Program. Bate, please take it away and tell us where you are and how you came to be here.
Yeah.
I I think you've got
Sorry.
some.
Yeah. Yeah. Good evening, everybody. My name is Bate Asapa. I am a trainee foundation pharmacist. So what that means is I'm sort of intermediary. I'm in between a qualified pharmacist and a pharmacy student. And how I got here was through university. So started off with my GCSEs. Have GCSEs in maths, English, and chemistry, physics, and biology. Then I went on to study my A levels, where I did chemistry, psychology, and biology. I got a combined grade of BBB. Studied at Keele University and did a 4-year course in Masters in Pharmacy. Successfully graduated on the 14th of July, and then I started on the 13th of July, a day before that. So for those who are wondering what a trainee pharmacist is, it's not quite the same as a pharmacist. It's just a step below. So what I do many things. Usually it's just speaking to patients, supplying medicines, giving them healthcare advice, and preparing methadone. So methadone is a watered down version of a drug called heroin, and heroin addiction is quite a big issue in Western societies. So the pharmacy often has its own methadone supply to give to heroin addicts, and they come into the pharmacy, and with their prescription, we give them that medication to help them with their addiction. On top of that, I answer calls in the pharmacy as well, just dispense more medications. That's my main job. Um, but to talk more about how I got here, I did an exam called the Oriel Situational Judgment Test, and that tests your ability to interpret what you should do in certain situations in a health environment, like a clinic or a hospital or pharmacy. And once you do that exam, you get ranked. And according to your rank, you get allocated to a pharmacy, which is where you'll do your foundation training year. Besides pharmacies, you can also be allocated to general practice, which is like a very watered down version of a hospital, or you can be allocated to hospitals themselves. And typically, most trainee pharmacists will be allocated to two different places. So I got allocated to a pharmacy, and I also got allocated to a general practice place. And what I do is I spend 1 week in a pharmacy and I spend the next week in general practice. And overall, I'm doing 52 weeks. That's the standard that you have to do for the foundation training year, 52 weeks. Um, I have faced challenges to get to this point. I will be honest. Despite the achievements that I mentioned before, you know, graduating, which is great and everything, it is always important to acknowledge the obstacles that you had ahead to get to the point where you are. So in my first year, I had to resit my calculations exam, which is very infamous in pharmacy because you have to do it every single year. And I also had something called an OSCE. So an OSCE is an objective structured clinical examination, which is where you are given clinical scenarios and you have to deduct the correct answer or action to do in that scenario. So it tests your clinical skills as a future pharmacist and as a future trainee as well. After an unsuccessful third year, I had to repeat my OSCE. Um, and after that, I had to repeat my entire year after an unsuccessful OSCE attempt. But it's okay because we got there in the end, and I'm very happy that I'm where I'm at now. I couldn't be happier, and I'm just one step closer to becoming a pharmacist. Um, so with the foundation training year, as well as everything I mentioned earlier, you have to also do something called a portfolio. So with a portfolio, every few weeks you have to do a reflection on how you've been performing, what you've learned, what you could do better, and you have something called a designated supervisor for your foundation training year, who is typically your pharmacist in the pharmacy, and they will assess how you've done and they will sign you off every few weeks. And just before you do the exam that you have to do to become a pharmacist, they will decide whether you're eligible to do that exam, which is very important. Um, yeah, and going back to my university experience, I did mention how I had obstacles ahead, and that's why I always say resilience is very important when it comes to pharmacy. It is a very difficult course. You will face obstacles. It's just about how you tackle them. And I think a great way to do that is having a group of friends or acquaintances you can study with. That has helped me immensely, and it's helped me cover my weaker points in the course. It's also important to put yourself out there. Um, Future pharmacists with more experience with things like going to conferences, joining elective campaigns tend to be more successful and tend to have a broader uh, job prospect. So they can venture into different things like industry, hospital, GP a lot more easily than someone who hasn't really put themselves out there. Um, in addition, I would advise you, if you're looking into this, to find a part-time job in a local pharmacy. You can even do this if you've not started the course yet. And this will help develop your practical skills. And by doing things like dispensing and speaking to patients, you will learn a lot more and you'll be a lot more confident to get before you get to the point of your foundation training year. But yeah, but thank you very much. If you have any queries, you can just email me and also ask in the group chat as well.
Fantastic. Thank you so much. Thank you so much, Bate. That's fascinating because, you know, so many of us will have that sort of would be able to relate to that, going through quite challenging situations during your training, especially those things about calculations. I just could not do the math. When I was going to go into medical school, I thought I could be an engineer. And I went to medical school in Kus Yaoundé in Cameroon, and you had to do a concours. At the time they called it, it was a competitive examination into the school. And before we went into CUS, I thought I could do engineering. So I did the concours to go into another school called Polytech, which was the engineering school. And the maths was too hard. I just could not get through. So I fully understand that calculation thing. But so far, how do you feel that the pharmacy, the journey into pharmacy, I know you're not fully a pharmacist yet. How's that feeling for you?
Do you mean when I started my foundation year?
From the beginning of your training all the way through to now and looking forward?
Yeah, it's been interesting because I do really enjoy pharmacy, and that's actually one of the things I suggest to people who are thinking about it. Like, I think it's such an interesting course. You
Yeah.
learn so much. It's so holistic because you learn about the human body, you learn
Yes.
about chemistry, but you also learn about, talking to patients and the clinical aspect, which is obviously the main aspect.
Yes.
But at the same time, it's been very challenging, and it's just about balancing those two contradicting things where it's like, how can something be fun but also be challenging at the same time? But I
Mm-hmm.
feel like the challenge is part of the thrill. And
Mm-hmm.
it's so rewarding when you finally reach the end where you can
Mm-hmm.
say, okay, I've passed everything, I've graduated, I've now moved on to my training year.
Mm-hmm.
It's honestly like it's an exhilarating feeling because it feels like you've achieved the unachievable, but it
Mm-hmm.
is achievable because there's tens of thousands of pharmacists in the UK, including
Mm-hmm.
Northern Ireland and including the rest of the British Isles, like Ireland. They're everywhere. They've done it, and if they can do it, then you can also do it as long as you have the determination to achieve it.
Excellent. Thank you. Thank you so much. We will be coming back to you, and thank you for letting us have your email address, because there'll be lots of very passionate young people who might just want to step into your footsteps. We'll come back to you. So far, you will agree with me that the two panelists that we've had have been absolutely brilliant. I just have nothing but inspiration from them, and I'm hoping that they will be also inspiring our young people who have joined this webinar and who are following live on Do Media UK, Do Media TV on YouTube. So we'll move on to our third and final panelist. Dr. Francesca Edomobi has the amazing history of being our first CamDoc UK student, medical student. She was the first CamDoc UK medical student because, as you may know, CamDoc UK is the Association of Cameroonian Doctors in the UK. And Dr. Edomobi is, you'll see here, she trained in Nottingham, but she will tell us a lot more about where she has been, how she's got here, and more about herself. So, Francesca, welcome.
Do you know something? With KeyBank, it's just like having all in one app. Come, let me show you. Here's my own UK pound account. Now I can receive UK bank transfers just like any local UK bank account. And here is my own personal Euro IBAN. Now I can receive Euro transfers from banks across Europe. Now comes my favorite part. With KeyBank, I can send money directly from my UK pound account to a loved one in Cameroon. I simply select the recipient, choose my UK pound account as the account I'm sending from, enter the amount, and tap Continue. I review the details, confirm the transfer, then authorize the payment with my 5-digit code. And just like that, the transfer is successful. Simple, fast, and all in one place. KeyBank, the one app.
Super, here we are. Yes, we noticed that the advert from KeyBank had no sound. However, I think that will be addressed. Now then, as we were saying, I can't wait to hear from Francesca. I did tell you that she was our first CamDoc UK medical student, and since then we've had other medical students join us. CamDoc UK being the Association of Cameroon Doctors in the UK. So, Francesca, tell us, how did you get to where you are?
Right. So I do have some slides that I will talk you through. And like I said earlier, I'll tell you about my journey, how I got here, and the challenges I faced along the way, and help you to decide whether this is a profession you want to go into. So this is how it all started. I was born and raised in Cameroon, and one of my sisters was born with a heart defect. So from an early age, we were in the hospital and in clinics most of the time. And one particular time that got to me when I was 11 years old was we had an appointment with the cardiologist, and we were in the waiting room waiting for him with other patients. The room was filled with patients, and we waited an hour. The cardiologist was nowhere to be found. We waited 2 hours, then 3 hours. Then he finally showed up. And this is where it gets interesting, because normally when you've been waiting for someone for 3 hours, the normal human reaction to that would be to be angry. Where have you been? I've been waiting for you for 3 hours. But that day, there's not anger I saw on patient's face in that clinic. It's actually like the face lightened with hope. Like, oh, the cardiologist was finally there.
Wow.
That was a light of hope. And I thought, my 11-year-old self then thought, I want to be that light of hope. When I come into a room, I want to bring hope. And that is what, and at that time, that meant being a doctor. And the reason why I'm telling you the story is, it will be difficult. It's a long journey, it's challenging. And what is going to help you through all the difficulties is knowing your why. Be crystal clear by why you want to get into the career. And that is what will help you bring it to completion and not quit. So as for me, when the dream became reality, I actually had to leave Cameroon at the age of 17 and come to the UK. I'm a native French speaker. So first of all, the language was a barrier. I had to learn English. And not only learning a language is different from studying in a language. So you can understand the different level I had to step into to be able to study in English. And throughout my training, I had to work part-time jobs to sustain myself financially. It was challenging. There were times where I had to go to placement throughout the day and then do a night shift in the evening. So it is a rough patch. And it's not a straight path either, because I thought it was going to take me 5 to 6 years to get there, but it took me 9 years. Not even because I repeated the class, but because I didn't get in immediately. So I had to persevere and do other degrees before I got to do my medical degree. So if you get one thing out of this presentation, is that community is key. Like Mrs. Morgan said earlier, I was the first student in the CamDoc UK association in the UK, and that's what put me through, because I was surrounded with doctors that I wanted to be like, and they were an inspiration for me. They were mentors for me. So one thing that I would stress on is to surround yourself with like-minded people you want to be like, so they can encourage you and be with you through all the hurdles, and you can learn from their mistakes. Okay. So moving on, I'm going to tell you about how to get into medicine in the UK. There are two paths, okay? You can get into the undergraduate entry or the graduate entry. They have slightly different requirements. If you're an undergrad, so let's say you're fresh out of high school and you want to get into medicine, you have to have excellent grades, of course. And those A-level, you need to have biology and chemistry. Again, different universities would have different requirements, so it's always good to check which university you want to apply for. And if you're an international student like myself, you would likely have to go through a foundation year, which is a year equivalent to the A-level, where they teach you biology, chemistry, English, physics, and help you apply for medicine. Wow. So once you've applied, you need to pass an exam called the UCAT exam. It's a 2-hour exam that tests your verbal reasoning, quantitative reasoning. There are some calculations involved as well, but not as at the level for a pharmacist. And after the exam, you have to pass. The third hurdle is to pass interviews. They call it MMIs, mini interviews, something like that, or panel interviews. So that's for the undergraduate side of things. But if you're a graduate, you already have a bachelor's. It could be in any field, history, geography, whatever, biomedical science. That's the one I did. But any field you've been, you can still be a doctor. So you need a first class or a 2-1 in your university degree. Mind you, some universities takes 2-2, but provided you have a higher university degree like a master's or a PhD. And then you have to sit exams again, GAMSAT or the UCAT again. So different universities takes different exams. Some people sit both exams. I had to sit both of them to increase my chances of getting in because it was really competitive. And then the last hurdle again is the interview. So in terms of deadline, you need to apply through UCAS. And if you want to get in, let's say next year, you need to apply this year by the 15th of October. Right, now I'm going to tell you about what I do as a doctor. I've summarized it in four things, not exhaustive. I see myself as part scientist because I understand how the human body works, what happens when something goes wrong. I have knowledge about it. I'm also part a detective because I investigate things, I get all the pieces of the puzzle and make sure they come together in a cohesive way to get to a diagnosis and eventually manage a patient well. I'm also part communicator, not just speaking communication, but listening. I have a good listening ear to know, to understand the person that is in front of me. And sometimes patients do come with like hidden agendas. You need to really listen in between the lines to find out what's wrong with them and help them to the best of your ability. I'm also a team member because I don't work in isolation. I work with pharmacists, sometimes dentists, physiotherapists, nurses. And yeah, it's a team on its own. And that's it. I really love medicine. And here are some reasons why. The first reason is that you are trusted by people at a very vulnerable time, which is a huge privilege, but also a responsibility because they trust you when they are their lowest to help them really. I like that sort of things. I like empowering patients about their health, giving them information they need, and helping them through their journey. Okay, I also like the continual learning side of things because there's no dull moment. There's always something happening. Now we have AI evolving, seeing how, it can help in medicine. It's like an evolving, a never-ending, never-stopping wagon. There's always something new to discover. I always have to be attending conferences and stuff. So it keeps me on my toes and I find it really exciting. And I love the variety because I don't just work with one group of people. I can work with a 10 days old 1 minute and then an 8-year-old comes up the door. So it's really is diverse, really. I love that. It keeps it exciting, like I said. And I get to work with different part of the team. And there are also opportunities to work outside of medicine. So medicine is not just wearing a white coat and going to hospital. I can decide to be self-employed. I can decide to be an employee or go into pharmaceuticals or public health. Like, the world is your oyster when you choose medicine. And I love that. You can change your mind halfway and decide to do a 360, change specialties, and that's okay. I really like the diversity medicine gives you. But I also need to tell you about the flip side of the coin, the not so good things about medicine. First of all, it's a long training. I told you it took me 9 years. Doesn't mean it will take you 9 years, but I know that it is long. And once you finish medical school, you also need to specialize and maybe subspecialize. So it does take time, and you need to be okay with the fact that now, if you're, let's say, in your A level and some of your mates go and choose other careers, they will graduate before you. They'll start earning money before you while you're still having exams and having challenges and working your way up. So that's something to bear in mind. The other thing is there's financial pressure involved because medical school is very expensive. You have to be happy or okay working weekends and holidays. You may miss some Christmas, New Year's while your family or mates are enjoying themselves, partying. You may be at work because you're a doctor. So bear that in mind. That's a sacrifice. It's emotionally draining and it's a huge responsibility. There's loads of uncertainty. You may not always know what is wrong with the patient, but you need to, carry them through it, through the uncertainty as well. And remember how I told you I wanted to be the light of hope that comes in the room? Well, I don't always get to be the light of hope because not every patient gets better, unfortunately. In fact, sometimes I have to be that very person telling a 40-year-old that he's got terminal cancer. And yeah, it takes a toll sometimes, and it's something to bear in mind if you're looking at going into that profession. You have to know how to have the difficult conversations. And also, if you're not careful and you don't have hobbies, you may even lose yourself in the job because medicine is so vast, and yeah, it takes a toll. Now, how would you know whether medicine is right for you? I think it's good to ask yourself the right question and be clear on why you want to do it. Is it because your dad wants you to be a doctor, or is it because you want to go through the street and hear people call you doctor? Is it your ego that's making you want to be a doctor? And there's nothing wrong with that. Just make sure your why is strong enough to pull you through all the challenges that you are going to encounter in the future. So ask yourself, do I enjoy working with people? Am I a good communicator? Am I willing to continually learn? How am I good at working within a team? Can I accept feedback? Can I keep humble or work under pressure? And do I really understand the sacrifice that it is to be a doctor? Now, I want to leave you with the practical steps. If you're still contemplating whether you want to be a doctor or not, these are the things I want you to be clear on. Like I said earlier, know your why, and it doesn't matter the why, just make sure it's strong enough and be proactive rather than reactive. So get meaningful experience. If you can have an internship in a hospital or a care home, do that. And even if you can't get an internship, look at it, think outside the box. Do you like volleyball, for example? Are you in a team of volleyball? Can you be the team leader of that? So if you are a team leader, then see how you can enhance your leadership skills, and those are transferable skills that you can use in medicine. Think outside the box, reflect. You can get a journal, write about your experience, either weekly or daily, whatever. Look at your strengths and weaknesses, develop a great self-awareness that will help you decide whether this is the right choice for you. You need to develop the right skills and do your research, because again, in the UK, like I said, different universities have different requirements. So you need to be clear about what they need and whether you can achieve that. Okay. Right. Thank you for listening. That was me. And yeah, I provided my email as well if you need to contact me.
Fabulous. Fabulous, fabulous. I was holding on to my seat all through. That's a fantastic story. And the way you've brought it really all out from the beginning, what stimulated you to go into medicine, how you went through the challenges, the opportunities, and where you are at the moment, what actually keeps you going. And I love what you spoke about, making sure that your why is what it is that's stimulating and making you continue in this profession. And I would say that I can see some trends, so like a golden thread going through all the professionals, all the three professions that we've addressed today, with resilience. All three of you have spoken about resilience. We've spoken about community, find your tribe, and feed on each other to support each other. I've also seen the thread of communication skills. What would you how do you communicate with people? Being a people person as in the caring professions like all three of you are, is really an asset. I know that if you are not a people person and you have gone to medical school just because you could make the grades, then you might just end up working in a lab where you're dealing with, as a pathologist, where you're dealing with slides and so on, or sit in a dark room and being a radiologist. Other professions that we might come to on the Young Professional Cameroonian Mentorship Program. Thank you, thank you, thank you. Esther actually says from the audience, she says, thank you for your inspiring stories. And I would actually, in fact, say thank you 3 times and more. At this point, I will encourage Do Media to play the advert that was supposed to be going on, but due to some technical glitches, they lost audio. So stay tuned, don't go away, and we will be back to you with some questions and answers.
Do you know something? With KeyBank, it's just like having all in one app. Come, let me show you. Here's my own UK pound account. Now I can receive UK bank transfers just like any local UK bank account. And here is my own personal Euro IBAN. Now I can receive Euro transfers from banks across Europe. Now comes my favorite part. With KeyBank, I can send money directly from my UK pound account to a loved one in Cameroon. I simply select the recipient, choose my UK pound account as the account I'm sending from, enter the amount, and tap Continue. I review the details, confirm the transfer, then authorize the payment with my 5-digit code. And just like that, the transfer is successful. Simple, fast, and all in one place. KeyBank, the one app for your money everywhere.
Fabulous. Thank you very much. And here we are at the end of a fascinating session. Well, not the end, we're not quite yet there because we have lots of questions to go through. But having listened to those 3 amazing young professionals, we have some questions for you, and I'll encourage my co-host, Dr. Gisla Dedino, our Vice Secretary of CamDoc UK, to come in with some questions.
Thank you so much, Dr. Morgan. I have to say, I have been treated to this myself, really taking in all the rich presentations from the panelists, and that sentiment is also shared by everyone who has been following. I will start by the compliments that have been shared from multiple people to all panelists here. People are really grateful for everything your lived experiences, and they make true meaning from that. One of the questions is addressed to Dr. Albright. And it's really about, whether you've faced any racial challenges so far in the course of your studies. So the listener is keen to understand, has your skin color been any worry or advantage?
And as far as, admission into dentistry, not at all. In Ireland, actually, we don't have the many interviews that is, common in different countries. So actually, your admission is purely based on your grades. So it's almost a faceless system, which some people think it's quite good. On the other hand, I do, considering some of the characters I met in dental school, maybe interviews would be quite good as well. But in terms of, racial discrimination, there's none of that. Ireland's, racial landscape is quite different to the UK or America or mainland Europe. During university, I was one of 3 Black girls. 2 of us were West African, 1 Cameroonian, 1 Ghanaian, and then we had an East African girl as well. There was actually no Black men in undergraduate. We had 1 maybe consultant from the UK, another one that was from East Africa as well. So I would say, especially, I would encourage Black boys, Black men to go into dentistry. Very, small demographic that I noticed. And then, in as far as now in a professional setting, I actually changed from a fully private practice, so private practice one where patients are fully paying for their treatment, to one that is in a lower socioeconomic area of Dublin that is half medical card or half public and half private. And I had, initially had my reservations, thinking that maybe in this area it is known to have, people who are maybe fully, dependent on the government for their living, or there's a lot of methadone patients that I see as well. So I'd expected some sort of racial incidents, but there actually hasn't been any at all, which I am quite lucky to say. I would say I probably experienced more ageist comments, very much like, "You're too young to be a dentist. Are you the person taking out my tooth today?" And that's a bit difficult to beat, because I often get, "How old are you? What year are you born in?" And you can't really skirt around those questions. So you just say it's due to lots of Botox. So that's the way I've gotten through that. But in terms of racism, none at all, which is great. And I do think that shouldn't be something that puts you off. I think people are well aware that immigrants all over the country, the diaspora, are doing amazing things in, really high positions of leadership. So please don't let that put you off. And if anything, the more that we see, the better. So
Yes, exactly. We like, and this is one of the amazing things of this program, in that young people can see the mentors, they see people that look like them in the positions in which they want to be. And so that's really fantastic. Thank you for bringing that out.
Wonderful, thank you. The next one goes to Dr. Bate. So you have mesmerized us with everything regarding numeracy skills, calculations, and all that. And somebody really wants to know, does the selection of candidates for pharmacy rely on, numeracy performance? That's, thinking about students who have just finished advanced level. So will they consider their maths grades? And also, can somebody become a pharmacist with only ordinary level qualification in maths, perhaps complementing with other subjects from the advanced level? If you can share your thoughts about that.
So when it comes to applying for university, typically they focus on your A levels more. And for A levels to get into pharmacy at an undergraduate level, you don't need to do maths. So you don't need to worry about having to do maths as a requirement to get into pharmacy. I'd say pharmacy is relatively not that difficult to get into. All you really need is decent grades. I feel like for dentistry and medicine, you need to kind of go above and beyond. But personally, I only got a BBB. And I got into Keele University, which actually has entry requirements of ABB through clearing. So it's really not that difficult. But in terms of GCSE requirements, I believe for most universities, you need usually a 4, which is equivalent to a C or above, at least in the UK. I can't speak for Ireland. I know Ireland is quite different when it comes to those kind of things. But you need a 4 or a C. And typically, if universities look at your A levels and your A levels are fine, maybe if you don't even have a 4, it's not completely like a no-go. They might still consider you. And there's a lot of universities that aren't very prestigious that do pharmacy at, the master's level, at an integrated master's level, like maybe Wolverhampton, um, Bradford as well. They don't really have high entry requirements. But yeah, typically for maths, it's a grade 4 or C, which I don't think is too difficult to achieve. I got a 5 in maths and I was expecting a 4. Most unis don't really think about that. Only the most prestigious unis will say you need like a grade 6 or above. And as for if you can become a pharmacist with average numeracy skills, yeah, I'd say so. Um, Obviously, you do have to worry about the calculations exam, which is essentially every year. I'm not sure if that applies to every university, but at Kiel, we had to do it every single year. And they made it more difficult every single year. But the thing with maths is that it's all about recognizing patterns. And with pharmacy, they're quite simple patterns. And once you get the gist of it, it's quite easy to just do the questions, if that makes sense. And sometimes they will merge different types of questions together. And when you know the patterns of those different questions, then it becomes quite easy to do. So it's not impossible. The only thing is that you need to just be consistent because it sticks with you throughout. Like once you've done your degree, when you do your year of training, after you've done your year of training, you'll have to do your GPHC exam, which I didn't explain in detail. But basically, that's the exam that you have to do to become a qualified pharmacist. You have to do it and you have to pass it. And the first aspect that you do is actually the numeracy exam. So that's out of 40 marks. I think usually you need to get about 27 marks to pass it, which is the majority. So it's just about staying on top of your numeracy. I think when you do your training year, they usually have like study banks that you can pay for, and you can build on your numeracy skills if you're struggling. And you can always go back to what you've done at university as well. They have resources for that you can look through as well.
Fantastic, thank you. And let's move on to the next question. This has to, I think each panelist will be grateful if you could touch on this because it addresses everyone. So it's about artificial intelligence. And the question from Fuese Fontem is, are there any worries that you have so far regarding the possibility of AI taking over jobs? Or do you rather think AI is adding value and enhancing professional productivity?
So maybe we can start with Albright. What's your point? What's your idea about AI taking over dentistry? So you'll have a chatbot asking you whether you've brushed your teeth today.
Yeah, I would love to see an AI, whether it's a robot or something, want to dive headfirst into a full mouth of gum disease or something. I think that's still very much further down the line. As of right now, we use AI for radiographs. So when we take an X-ray of a patient, we have AI models that can sometimes pick out whether there's decay. Sometimes it misses decay for a piece of bone or something like that. But I do think AI is quite helpful because it can light up images, explain things to patients in a visual manner that sometimes, me pointing out this shadow of black against all the gray doesn't make sense to a patient. But they still have to be cross-referenced by a professional. Even myself, I find sometimes, just in the old clinic that I worked in, the AI was built in automatically to every X-ray. So when you take the X-ray, the AI findings are straight on the screen, and it can actually sometimes prime your brain to see things that aren't actually there. So I always turned it off. I was like, I don't want to see the AI until I've, looked at it myself. I think more so, definitely AI can add value. In terms of dental implants, we have AI systems that look at a certain type of X-ray called CBCT, which is a 3D X-ray. So when we want to put a little screw in your jaw, we have to check you have enough bone and dimensions, and that can help the surgeon in planning what sites to put in implants. And again, AI is used for, say, head and neck cancer patients as well, for, again, diagnosing and also treating. So it's definitely already in all aspects. I think the main thing is just using it alongside. I don't think it will take over dentistry. It's very much a going to the office job. And I think more so patients being equipped with AI. So I get patients that come in and they're saying, ChatGPT told me XYZ, and ChatGPT told me that oil pulling can help my gum disease. And, I think sometimes your initial reaction is to be on the defense and be like, I'm the professional, I know what's what. But I do think it is quite helpful because a lot of these patients are, quite nervous to come to dentists. They want to see what it's, going to be like. And I encourage patients to do research that they'd like and to ask me any questions if they're confused about things, but definitely more so a friend than a foe. in my opinion.
Fantastic, and that's a really pragmatic way of looking at things. How about yourself? What do you feel is the impact of AI in the pharmacy, Batty?
Yeah. So I think it's complicated. Generally, we don't advise against AI. We don't advise against it. I think it depends on the field. So for hospital and general practice pharmacy, if you work in those fields, you might find AI more useful when it comes to like filing away stuff or like, medication reviews, things like that. But for the most part, we still believe that like guidelines, the national guidelines in the UK, they take precedence over AI. So, for example, the British National Formulary, the Electronic Medicines Compendium, and the Specialist Pharmacy Service, I believe it's called. Those things, we tend to look at those things first before looking at AI. And we've also had a thing where a lot of patients will come into the pharmacy, they've looked at something using ChatGPT or other AI models, and it's been downright incorrect information because it's not sourced. Like AI can usually only give fully accurate information if you ask them to source it from the guidelines that I mentioned earlier.
Sure.
Otherwise, sometimes it can hallucinate and give the wrong information. And we've had to explain it to the people who've come in that this is actually wrong. Actually, you need to do this. We can give you this. We can give you that.
AI on methadone, huh?
Yeah. Yeah. So it's complicated. It's not something I would write off. Like I said, for things like hospital and GP pharmacy, it's definitely more useful. Especially when you want to like generate a profile for a patient. But especially for like being in a community pharmacy, it's a lot more tougher than that, I'd say.
Yeah.
So
Yeah.
yeah.
So very similar to Albright, your view is
Yeah,
that
exactly.
you just have a blended view on things. What about
Yeah.
Dr. Edomobi? What are your
Right.
thoughts?
Well, my answer would emphasize what Dr. Ney said, is AI is more a friend than a foe, really, because it's a useful tool, and it actually saved me time in my daily practice. Yeah, because seeing patient, you can actually now record them after consenting them, you can record it, and then AI gives you a nice, beautiful summary of the conversation that I just have to read through and edit a few stuff, and that's it. So yeah, it used to take me a lot more time to do it, but with AI is more effective. And I would say AI is good in interpreting data and doing admin stuff, but there are also things that AI cannot do. It cannot read nonverbal cues of a patient, for example. It cannot examine a patient. So it's more of an additional tool that doctors use rather than taking doctors' job.
Yeah, absolutely, absolutely, and I'll fully endorse that. AI cannot give your patient a hug when they break down in tears when you've given broken bad news to them. Can you? Can they? So fantastic, good. So, Dr. Didino, any other burning questions in the audience?
Yes, we have just a few more, which hopefully we can work through quite quickly. Daisy
Yep.
Ray is asking Dr. Francesca if you can share on the pathways and opportunities for Cameroonian medical doctors who wish to work and/or specialize in the UK, and what main challenges should be anticipated along the way.
I don't know. I think maybe that would probably be an unfair question to Francesca because, as she's told you, she's trained in the UK. She started as a medical student here and has gone through all her training here. Well, I would give you a little bit of a summary to that, Dr. Daisy Ray. If you have trained in Cameroon, or elsewhere in the world, anywhere apart from UK or the EU, you will have to get into the UK training system through either an exam called the Professional Linguistics and Ability Board, the PLAB test. And there is a whole minefield of different ways to go through things. 35 years ago, 30, 36 years ago, I qualified as a doctor in Yaoundé, Cameroon, and I did the PLAB test and came to the UK and started my training here. Things have changed enormously over the past 35 years. The challenges and the opportunities are much, much different. They involve looking at the political landscape of the country, the training landscape, and also things to do with immigration. So just as a summary, I would say that please contact CamDoc UK through our website if you wanted some further advice. I would suggest that you do some more research. We won't be able to, in this session, give you a potted answer of how to come across and train in the UK or to continue your medical practice in the UK. But if you were able to give us some information to work on and go through our CamDoc UK website, we might be able to give you some pointers. I hope that's sufficient, Dr. Desiree, and we'll move on to the next question.
Thank you, Dr. Morgan. I'll carry on straight away. So a question for our panelists. It's just about career path, and this is sort of looking to the future. Someone's asking to know what's the career path from junior to highest level. So now that you've already gotten, sort of your feet under the desk, so how do you become a consultant, and is the career coming across as worth the while with respect to the earning potential apart from your job satisfaction? Do you also get career development, progress guidance? So maybe just a light word on that for those aspiring to take on your similar steps.
Okay, so let's put this in really 3 little nuggets. For each of our panelists, say, what are your aspirations? What is the financial outcome? What is the potential financial outcome? What are you aspiring to when you get to the top of the tree in your profession? And where could you be in the middle? Is that fair? Okay, so as per usual, we'll start with you, Albright. Oh, no, let's switch it up a little bit. Let's start with with Bate. We'll start with Bate. Let's start with the guy.
Yeah, so obviously right now I'm in quite an intermediate position as a trainee pharmacist. In terms of aspirations, pharmacy is a big world, kind of like being a doctor. You can be in a hospital, you can work in a general practice surgery, or you can just stay in community. You can even work in industry. So industry is when they make like chemicals, like the actual medication and medical devices. And you can also work in management. There's just so many things you can do. So to be quite honest, I'm not entirely sure where I want to end up. Like when I end up at the top, I'm not sure where I want to be yet. I'm still passing out, what I prefer, what I don't prefer. I'm still doing a lot of research. But the world is your oyster when it comes to pharmacy. Once you get that master's in MPharm degree, the world is literally your oyster. You can do anything if you put your mind to it and you're willing to look for what's available. But with regular like career progression, when it comes to hospital, you can progress in bands, band 6, band 7, band 8, and obviously your salary will increase. I met a senior pharmacist when I was on placement, and he was making quite a lot of money compared to the other pharmacists at the hospital.
What's quite a lot?
Honestly, I forgot. It was somewhere between like 60 and 70,000. Because hospital pharmacists, they get lower rates of pay compared to people who work in community.
Exactly,
GP.
because working in the public sector and working in the private sector is different. As a public in the NHS in the UK or within any public sector, you will have a salary, and then you can possibly top up your salary depending on what you can do. You can do locums, or you can have another kind of sideline, a side hustle, just like everything else, right? Yeah, so that's
I was actually going to say that as well. Yeah, so locum rates tend to be higher as well, and So maybe that might empower you to do locuming. It's just, are you willing to adapt to the different things, like having to go to different pharmacies where there are just so many vastly different rules? But if you can do that, then that's also great as well.
Yeah.
So it's really just up to you.
Yeah. Okay. All right. What's your take? How much can you be rolling in as a dentist? And is it really true that all dentists have Maseratis?
I'll go outside really quickly and check whether my Maserati is outside. But as a general rule, I think dentistry is like capitalism personified almost. Again, you are earning a percentage of every treatment you do. So if you can do an examination, people always have a story. They go into dentist, they're only in for 5 minutes, they charge them £40, you know? So if I can do an examination in 10 minutes, I've earned, 20 euros in that. And if you compound that, you can earn a lot. And I would maybe make this message to people in Ireland anyways, with the medical card or the NHS in the UK. I know the rates are different and people tend to try, skirt off doing public work. They only want to do private because the earn potential is more.
Absolutely.
But I would say I'm almost earning more now working in a mixed practice rather than fully private. So it's really up to you. And again, you can earn as much as you want. If you want to work 5 days on 5 and you want to work from 8 to 5, and again, if you're doing 10-minute examinations, your exams the whole day, you have a really big potential for earning. If you're doing more complex treatments like dental implants, oral surgery, removing wisdom teeth, providing IV sedation, these are all things that you can add on to your general dentist degree and get to doing. So I would say, like right now, I feel comfortable in saying that I'm 23 years old and I could earn gross from like 5,000 to 7,000 a month. And that's just doing general dentistry.
5,000 or 7,000 euros.
Yeah.
Gross. So that's before tax.
Yeah. Which is, compared to, people leaving at the same age as me doing finance or things, it is quite a big jump. And like I've said, you have to account for your pension, all the other things at the side. But I think there is a big push for people to specialize, and dentistry is great as well. It's a big world. You can end up doing, like I said, max fax, you're earning hundreds of thousands. Like you really are. That's probably the biggest that people are really interested in. But again, you have to think about doing your extra years of medicine and then the actual training pathway for that. You can be an oral pathologist that requires doing medicine as well. You can be a dentist that specializes in braces, in peds, children, in geriodontology, that's elderly patients, and special care, that's patients with loads of existing health conditions that might preclude their treatment in general practice. Loads of different things that you can do. The main thing with specializing for me, and from my year out, I've kind of realized that general dentistry, I don't think it's for me. There's definitely treatments that I hate doing. So I think I'd prefer to go into oral surgery. And for me to do that, I need to do 2 hospital years. So I need to do junior house officer position and a senior house officer position. That's the same as in medicine. So 2 different years. So I'm hoping to start my first year next year. And the cost, I think, is around 60,000 euros per year. And it's 3 years for any specialty in dentistry. So if you think about that, that's something you need to offset. So you might be earning a lot more once you're a specialist, but you have a lot of debt to pay afterwards. So that's the balance of it. I could just say general dentist for the rest of my life and do this. And again, still upskill, still doing CPD, continued professional development. But there is a great earning potential. There was at one point I was doing 6 days a week, but you really do get burnt out. I don't recommend
absolutely
doing
and
like that.
And like in any profession, if your cup is not full, you can't pour, especially a caring profession. You have to have your cup being filled before you can pour out to offer that care to other people. So finally, Francesca, what is your take on the same question?
Yeah, pretty much the same. There is so much variety. You can go into locum if you're in there if you want more money, or you can decide to get into training, which is when you are in training, it's a bit more restrictive because you don't control your rota or anything like that. So rota is given to you and you need to adhere to it. But if you're a locum, you have more freedom with your time, but then you also have to manage your taxes and your pension and all that. So it all depends on what rocks your boat really, and you really want at the time.
Yeah, and I think I agree with you there, and I think that the other thing that comes out of the other theme that comes from all 3 of you is getting to have life balance. you know, they used to call it a work-life balance, but it is a life balance. You make choices which impact on how your quality of life. You can have as much money as you want as you would like in the bank, but if you don't even have the time to go to the cinema with your chérie Coco Fidoline, then there's no point making that money. Is that right?
Definitely.
So there you go. Dr. Dedi, no any further questions? We are thinking about starting to wrap up. We have 10 more minutes on the program. So if we can crystallize these 10 minutes into some really, really impactful questions from the audience.
Yeah, absolutely. So this one just has, I feel that Dr. Morgan, you may need to address this one because it's more about general knowledge about this session. So I suppose the first time attender, Esther, is keen to understand how this young professional scheme mentorship program works and whether mentors are assigned to aspiring doctors.
Oh, wow. So that is such a fantastic question. Welcome, Esther. I'm excited to see you here today and everybody else who has joined us. As I said at the beginning, the Young Professional Cameroonian Mentorship Network is the brainchild of our own very chief, Asaf Wase Konko. He is a senior member of the CamDoc UK executive and our international committee chairperson. So he is really a people person. He has a role within the community and within his ethnic tribal group of the Bangwa people. So he's a chief. And what he saw was that we at CamDoc had the possibility of gathering knowledge, skills, and opportunities to offer to our young people within the Cameroonian community. So this one today is about medical, pharmacy and dentistry, but we've had other sessions. We've had a train driver. We've had the last one was all about the law. So we had a barrister and a solicitor doing the mentorship program. We've had people who work in other branches of healthcare, lots of other professions, you see. So this here is just CamDoc's way, CamDoc UK's way to give back to our community, to encourage, empower, and open up opportunities for young people who want to go into various different professions. And really, it wouldn't be here. I must acknowledge Chief Dr. Asa Konkwo, and this is the right position for me to say one of our very, very passionate members of CamDoc UK, and that is Dr. Collins Asongazie, who's has been one who has really carried this program through till where it is today. So what we do is open up these opportunities for networking, for encouragement, inspiration, and support. So if you, Esther, have any suggestions for us to take this program forward, we would be delighted to hear from you. And I think we can give, if you go onto the CamDoc UK website, we will be able to take any questions, or you'll get some information from there. And we look forward to hearing from you and anybody else in the audience who would say, hey, you know what? I think my profession of fly swatter is the best in the world. Let us talk about being a fly swatter, and we would love to take you on.
Fantastic. Thank you so much, Dr. Morgan. So we have one question for one panelist and then one final one for all before we close. So Bate, Eugenie is asking to share your thoughts about what interacting with other specialty colleagues looks like. So for instance, if a medical doctor is asking you advice about a new medicine they would like to prescribe to the patient, which is perhaps different from what they would normally do dealing with their patients, perhaps, appreciating that this is early on in your career, but do you have any thoughts as to what that feels like? And maybe the other panelists too, if you have something you wanted to share regarding this, please do.
Okay, so it might come from a place of bias, but based on what I've seen, on placements and in my foundation year, typically the pharmacist is the one who is contacting these health professionals like, doctors, dentists. So obviously a pharmacist is an allied health professional. It falls under that category, and dentists, doctors, so on and so forth. Anyone who can prescribe is like more like a main health professional. But so usually pharmacists will contact first when they recognize things like errors, which are a bit common, especially when you're working in like a community pharmacy. Sometimes they tend to make like dosing mistakes, prescribing mistakes, and actually that is one of the things that the OSCE at university for pharmacy was based on. Recognizing that maybe a prescriber has made a mistake that needs to be corrected. Maybe it's an overdose. Maybe the dose is too low to have a therapeutic effect on the patient and things like that. And I think this question just highlights like how important pharmacists actually are. You could say pharmacists are quite underappreciated in the healthcare sector for things like this. And especially in hospitals, pharmacists tend to do medication reviews where they are in more contact with doctors and other health professionals as well, where they're more closely knit because they're in one building at the same time. And you do get those interactions a lot because, there might be prescribing errors, or maybe there's contraindication, maybe a drug has been given for the wrong indication. So many issues, numerous issues. I've spoken to so many pharmacists at all these places during my placement, and they told me some legendary stories. But in terms of other health professionals like doctors contacting pharmacists first, that also does happen as well. And it just becomes a thing where it's about, mutual respect for each other, understanding that no one is infallible and communication is key for patient care. If health professionals can't communicate to each other clearly and lucidly, then it can result in a lot of patient safety issues. And I think it's just important for everyone to have that in mind, whether it be pharmacists, whether it be doctors or dentists. It's just always important to have that at the forefront of your practice.
Fabulous.
Wonderful.
And I'll just jump in here to say, honestly, these three young panelists, and I keep coming back to the word young because young is the Y of YPCN, and they seem to be young, but they have such mature and well-established spirits, and the way they've come across today has really been inspirational. I do agree with Dr. Eugenie Mempo, who is our CamDoc UK membership secretary, that that has been a really fantastic response, Bate. Thank you very much. So Gisela, any further questions? Any burning questions?
Yes,
Before
one
we wrap
final
up,
question.
one final question.
Yes, and I suppose this is to all panelists, but perhaps not compulsory for everyone. If you have any thoughts, just put them in. So there seems to be a concept regarding access to medicine courses or access to medical courses. Not entirely sure what our listener is intending, but the question, so he has expressed the fact that these seem to be notoriously difficult for the UK and Ireland, and they're asking whether these are a must. So I wonder if any panelist has an idea on these and some thoughts to share.
I can weigh in for Ireland. So, like I said, I think compared to the UK, to enter dentistry is actually quite easier in Ireland. So all you have to do is as she says, is get quite excellent grades in your leaving cert that we call it the A levels. We actually do 6 subjects instead of 3. Our depth of those subjects is night and day compared to the UK. I've compared my biology books to A level biology books. It's way easier every point. So if you get the grades that you get assigned points, and then these points help you get into university. There's no extra examinations. There's no extra exam. In Ireland, we have the extra exam, which we call the HPAT to enter medicine, but there's no equivalent for dentistry. So it's purely based on your leaving points. I recently had one of my cousins from the UK actually come and shadow me in my practice, and I kind of said to her, the easiest way to get into medicine or dentistry is the school leavers route. You have the one chance to do your best now and you get into it straight away. Not to say that graduate entry isn't possible, like Dr. Francesca had gave us an overview of, but obviously it's a bit more timely, a bit more costly. And I do think the hardest part of any of these courses is entering it, because once you're in it, as long as you attend your lectures, you revise, you will make it through, you will get through it. But I think missing kind of the golden sweet spot, the opportunity to enter it as easily as you could, it shouldn't be wasted. You're never going to be as young. I always think to myself, what else could I have been doing at 16, 17 bar kind of studying? And I think you will thank yourself for doing that. And Ireland is not really a graduate route that way. It's literally just points. I think there's added bits of like a personal essay and things like that. In Ireland, we actually don't even do that as part of the school leavers. There's no interviews, there's no essay. It's just purely based on your examination. So I think it's a pretty fair playing field.
Fabulous. Thank you very much. Who else was going to answer that question? Francesca?
I didn't quite understand the question. What did you ask me?
Yeah, it was about access to medicine courses and if these are a must to be able to get into medical school in the UK, for instance.
Oh, right. Or like the foundation year I did. I think if you're coming from it depends. I don't think there's a straight path if you've graduated, if you did high school in Cameroon. There's no straight path to convert your baccalaureate to what they would require here. So you would have to go through a foundation year.
I think somehow I kind of get the feeling that this might be a specific, a question that might need specific review, possibly. So at the end of this program, we will have our email addresses that you can contact us, and we will possibly be able to deal with those specific questions. Okay, so possibly if that's us now, we're through with all the questions. Thank you very much to everybody who has attended today. We really, really, really appreciate your time. We appreciate the fact that you have chosen to spend your Sunday evening with the YPCM and be inspired, encouraged, and stimulated by our three amazing panelists. At this point, I'd really like to remind you that the program has gone on live under the auspices of Do Media TV, live on YouTube and other streaming channels. The recorded version will be available on the CamDoc UK website, as well as being provided to various schools in Cameroon. We do encourage you to forward all of our content to anybody who you think might benefit from it. And we, as I said earlier, we would really appreciate any suggestions for further career topics that we can deal with on the YPCM program. Next, and I am very, very excited to announce the next YPCM would be in September. And guess what? It is going to be dealing with a topic that is not very well understood or very well advertised, and which people have all sorts of ideas and thoughts about. And it'll be dealing with training to be in the religious ministry. So we're going to have a priest, a deacon, and a non-Catholic minister joining us here on the 11th session of the Young Cameroonian Professional Mentorship Program. So I look forward to welcome you then, and I will sign off now from myself, Dr. Montia Morgan, my co-moderator, Dr. Gisela Dedino, behind the scenes, Dr. Collins Asongazie, as well as Chief Dr. Fwase Asa Konkwo. Thank you very much and have a wonderful evening. Bye-bye.
Do you know something? With KeyBank, it's just like having all in one app. Come, let me show you. Here's my own UK pound account. Now I can receive UK bank transfers just like any local UK bank account.
And here is my own personal Euro IBAN.
Now I can receive Euro transfers from banks across Europe. Now comes my favorite part. With KeyBank, I can send money directly from my UK pound account to a loved one in Cameroon. I simply select the recipient, choose my UK pound account as the account I'm sending from, enter the amount, and tap Continue. I review the details, confirm the transfer, then authorize the payment with my 5-digit code. And just like that, the transfer is successful.
Simple, fast, and all in one place. KeyBank, the one app for your money everywhere.
With MoneyFX, sending money home just got faster. Enjoy top exchange rates, low fees, and transfers that land in under 10 minutes. Whether it's school fees in Cameroon, hospital bills in Nigeria, or family support in Ghana, MoneyFX makes every transfer count. MoneyFX, fast money transfer when it matters most.
Thank you.